If you are on a GLP-1 medication to lose weight, or you have lost weight and you're considering cosmetic treatments, or maybe you're dealing with some loose skin, well, then this is definitely the podcast episode for you. I'm going to be joined by a plastic surgeon who specializes in patients who've lost massive amounts of weight and helps them to get rid of their excess skin. So we're going to talk all about that, but we're also going to cover topics such as, if you do lose weight, what can you do to prevent skin from getting loose? What about these cosmetic treatments to tighten skin? Do they work, and which ones work better than others? We're going to talk about how your collagen is affected by weight loss, especially if you're undergoing GLP-1 medication treatment. And she's going to give us specific pearls if you're going to have surgery that you should consider. If you're going to have, let's say, a breast lift, a tummy tuck, an arm lift, a thigh lift, what are specific things you need to consider if you're going to undergo any of those surgeries to kind of help you to prevent having a problem and hopefully getting you the result that you want to? Okay, so let me go ahead and introduce my guest this week. Her name is Dr. Rukmini, or she goes by Vinaya Rednam, also known as the Confidence Doc, and she is a board-certified plastic and reconstructive surgeon based in Houston, Texas, and a founding member of My Houston Surgeons. She has a practice focused heavily on plastic surgery after massive weight loss and advanced body contouring. She's passionate about helping patients complete their transformation journey and regain confidence after significant weight loss. She's also the host of the Confidence Doc podcast. She's an international speaker, entrepreneur, and jewelry designer with a passion for blending confidence, aesthetics, business, fashion, and wellness into everything she does. So Dr. Rednam is going to join me today. We're going to talk all about losing weight with GLP-1 medications. We'll talk about surgery, and we're going to talk about how you can deal with skin issues that can appear after you lose the weight, as well as, once again, get into some really practical pieces of advice. So I think this is going to be a really informative and entertaining podcast, and I'm glad you've joined us. Let's get started. Thank you so much for joining me today, Vinaya.
Thanks for having me.
So I'd love to start by asking you to tell us your story. You're a board-certified plastic surgeon. Can you tell my audience where you trained, and then how long you've been in practice, and why you decided to really specialize in patients who've lost large amounts of weight?
Yeah, so I'm going on my 11th year in practice. I trained in the University of Kentucky. I did an integrated residency where it was 6 years with my plastic surgery and general surgery. And then I did a 1-year aesthetic fellowship at the University of Florida. And then I moved to Houston, Texas, where I practice. And I've been in my same practice now for 11 years.
And so why did you decide, as plastic surgeons, we train in all types of surgery, from cleft lip and palate to breast reconstruction after cancer to cosmetic surgery. And you've really focused the majority of your practice, my understanding, is on patients who've lost large amounts of weight. Why did you decide to go in that direction? Especially for somebody, we met in person and I'm like, you're really small. And for me, sometimes I feel like, geez, these operations, you're removing huge amounts of skin. It's really physical at times. And I was like, wow, that's an interesting thing for somebody so small to have decided to specialize in.
Yeah, well, there's a personal reason, and there's also just I love these surgeries. Personally, I actually was a very obese child, and it's hard to believe if you see me in person now. But I went through a lot of those struggles, even really up until probably the end of college, and so I feel like I understand. Now, was I ever 400 pounds? No, but I really was. I've gone backwards in my weight when most people go the other way, and so for me, there's a personal aspect that I really feel a connection with my patients, and I really understand what they're going through. And then from a just fulfillment, I love the artistry of weight loss surgery. And I know a lot of plastic surgeons aren't as excited about this area. It's very physical, like you said. I really have to do a lot of weightlifting and really stretch a lot beforehand. But I really love that you can take someone who had hundreds of pounds, and then I can basically create something that's like a whole new image for them. And just, I call them my butterflies. Like, I get to see them come out of their cocoon, and I love it.
So I myself treat a lot of patients who have lost a lot of weight, but I don't necessarily specialize in it. That being said, I would say probably about 60 to 70% of my patients are on GLP-1 medications right now. So for my audience, these are the weight loss medications like Ozempic, Wegovy, Zepbound, all that. what percent, you've focused mainly on patients with major weight loss. What percentage of your patients are on a GLP-1 medication? I have to assume it's higher than what I have.
Very high. I would probably tell you at least 70% of my patients on a GLP-1. And I actually looked this up because I was curious, but 1 in 8 Americans are on a GLP-1 now. And so it's obviously not everybody is on it for major weight loss like we would do with some of these surgeries. But it's become so common that even a lot of my bariatrics, so these are people that had the surgical weight loss, are using it for maintenance afterwards.
And this is something I wanted to ask you, when you think about bariatric surgery, I mean, it's obviously invasive. When do you find that patients need bariatric surgery over, let's say, GLP-1s? Is this something that is taken care of before you see the patient, or do you also help to counsel patients along the road as they're losing weight?
A little bit of both. I work with a lot of bariatric surgeons because it was an area I loved. I went out, I met everybody in town, and most of them do a really good job, I think, of doing that type of counseling before I see people. But I have a lot of people who just reach out to me about it. So I will do some counseling, but I really like to leave that up with the experts. So I will usually hook them in to the networks with either medical weight loss or bariatric surgeons for them to discuss that because it is so much more complex. And even though GLP-1s are amazing medications, there are still people who need the surgery more than they need the medication alone.
From your standpoint, who do you think is a better candidate for surgery versus the medications?
Oh gosh. I think that for the surgery versus medications is how much do they have to lose? What kind of other medical issues do they have, right? So if we have somebody who has a significant amount of medical issues and they may not be able to move as well, there's actually mobility restrictions. Sometimes surgery is going to be a better route for them. Versus the GLP-1s, it's, there's still a lot of lifestyle modifications that need to be done for it to be successful. But you may not get the dramatic weight loss that we see with these surgeries with everybody on a GLP-1. Some people get it, but not everybody.
And are you seeing patients getting, in general, gastric sleeve surgery, or are they still doing the gastric bypass? Are you seeing both? And if you're seeing both, then do you know how the surgeons decide which to give which patient?
Sleeves are much more common now. A lot of times I'm seeing that the bypass is happening if somebody's failed a sleeve. So maybe they haven't lost as much as they needed to, or because sleeves are being performed more now by people who aren't necessarily bariatric surgeons, there's complications and they're not sometimes being performed properly. And so those are people that I'm seeing then end up seeing a fellowship trained bariatric surgeon who then will convert them to doing a bypass.
So for my audience, if you're wondering, okay, what's the difference between these operations? In general, a gastric sleeve operation, you take the stomach and you cut out a portion of it to make it about the size of a banana. In a gastric bypass, the majority of the stomach actually is removed, and you really are only about the size of a golf ball. But a huge difference too is that you actually reroute a portion of the small intestine, removing a portion of it, taking it kind of out of the equation so that you can absorb less of the nutrients as well, and you can lose weight a bit faster. And so a gastric bypass being kind of the classic operation that has been done for, when I was in residency, this was over 20 years ago, they were doing it. Now they're doing it with robotics and laparoscopically and stuff. But the gastric sleeve is something that's definitely more recent.
I think that they are favoring doing a sleeve more because there's less malabsorption issues. So people are getting their nutrients in a better way than with the more traditional technique.
Actually, I've heard surgeons tell me that when they operate on patients who have lost weight via a GLP-1 medication, they treat them differently than they treat patients who've lost weight either without a medication, so naturally, or with a bariatric surgery. And what they tell me is that they believe that the GLP-1 medications do affect the collagen of the tissues negatively more than, let's say, just general weight loss or weight loss via surgery. Is this something that you have seen in your practice? And if so, what do you do differently than when you treat these patients?
So I've heard that, and that's why a lot of people do it. I don't know that I've truly always seen that. I think that maybe I noticed that in people who are utilizing it, who maybe don't need to be utilizing it for weight loss, and that I feel like I'm seeing thinner tissue in them. I generally will have them stop using a couple weeks before, and then I wait till we get past our 6-week mark for healing before I allow them to get back on it. But it's hard to say in the people who maybe have losing hundreds of pounds with it, their tissue quality wasn't great to begin with. So it's hard to say head to head with that. So for me, it's really these slimmer patients who are losing it rapidly that potentially it may be causing some more thinning in their collagen.
Yeah, I was talking to one plastic surgeon and he said, oh yeah, if I ever do a lift with implants on a patient who's on a GLP-1, I'll always use some type of a mesh or an ADM, which is like an allograft type material, to help to support the implant because their collagen is so much worse. And I haven't seen that in my practice, and I see a lot of patients on GLP-1s, but this doctor was telling me, and really good surgeon saying, whenever I see it, I always will put in mesh instead just to help prevent drooping that they would normally not use in a patient who's not on a GLP-1.
But that's the same as a bariatric weight loss patient to me. Like that's the same issue we're seeing. So the question is it because of the GLP-1 or is it because they've lost weight rapidly? And so they're having the same issue there that somebody with even the weight loss from surgery would have. So I guess I can't separate it in my practice because I have so many people that are all coming in with that same issue.
One thing that I try to encourage people who are on the GLP-1s and they're losing weight, though, is to make sure then that you prioritize protein, so you avoid as much as you can sarcopenia or breakdown of muscle, as well as consider taking a collagen supplement, because if that's true and it does impact the collagen that way, then those are two ways that you can kind of help to fight that process off. One question that I also get too from patients all the time is that if I lose weight slowly, does that impact my skin differently than if I lose weight more quickly? Or another way to put it is if I lose weight rapidly, am I going to end up with more loose skin than if I lose it more slowly?
Yeah. So I think it's a piece of the puzzle. I don't think that alone can help you. Certainly, I think slow and steady weight loss allows your body time in your skin to slowly retract in and adjust. But I've also seen people lose hundreds of pounds quickly, and you wouldn't believe that they have so little skin excess. So I think that genetics is a huge part of it. I think that it's the one thing that we can't control at this moment is how genetically we're wired to heal with or to retract our elastin. But I think that certainly overarching, yes, if you can lose your weight slow and steady, not only does it allow your skin to retract, but it also allows your body to keep adjusting slowly. I think when things happen rapidly, the highest likelihood is that you're going to have a large amount of skin excess.
Hey moms and dads, real talk. Most of us grew up thinking that all of our cleaning products were safe. But the truth is, many conventional cleansers are full of harsh chemicals that can cause a host of health problems, from eye and skin irritation to disrupting our hormones and more. So it can be hard to figure out what's actually safe. Well, that's why I love Branch Basics. They take the guesswork out of finding safe cleaning products because they are completely transparent about what goes into each product. Everything they make is plant and mineral-based, fragrance-free, and most importantly, human-safe. They've even earned Made Safe certification, which means independent scientists screened every ingredient and the final formulas for over 15,000 toxic substances commonly found in cleaners. So you can really trust what you're bringing into your home. And for anyone thinking that switching to safe cleaning has to be complicated or expensive, think again. Branch Basics surface cleaners are just under $5, so you can get started with a few simple swaps without spending a ton of money. And their refill system makes it really easy. Once you run out of one of your surface cleaners, you'll only have to restock their signature concentrate, which you dilute at different ratios to refill the surface cleaning bottles for every room in your home. Tackle everything from messy countertops to bedroom tubs and sinks without worrying about harmful chemicals. It's better for the planet and better for the people you love. So next time you're at Target or shopping online at Target.com, grab Branch Basics. Human safe, pet friendly, cruelty free, and made for the most sensitive. Whether you're going all in on safe cleaning swaps or just starting small, find Branch Basics at Target and Target.com today. Do you have any recommendation if somebody asks you, well, then how many pounds should I lose a week or a month? I mean, I don't have an answer for that for patients. I tell them, look, everybody is different. And it's harder for some, I get patients who come to see me, oh, I'm going to lose 30 pounds in the next 2 months. And I'm like, are you sure?
Yeah.
Are you sure that's realistic? And then other people will say, hey, I'm going to lose, 20 pounds in the next year. And it's like, okay, yeah.
Yeah.
So do you have any suggestions for them if they say, hey, how quickly should I lose this weight?
Okay. So again, hard because they used to say half a pound to a pound at most, but for somebody that could be a lot losing that much in 1 week. So I guess my suggestion would be is if you're with like anything, you got to dip your toes in. Once you're starting your weight loss, see how things are looking. And then you have to kind of adjust and see because you're not going to lose 50 pounds immediately. So if you got I think I would aim to say, hey, let me try to see if my goal is to restrict and increase my exercise. I'm going to go maybe a half a pound a week. So I think that's a good place to start if you have a significant weight excess. If you're looking to lose 20 pounds, I'm not going to tell you to lose half a pound a week. That seems like a lot to lose that quickly. So I think you have to look at your overall plan. And I think the big thing is if you have a significant amount of weight to lose, don't do it by yourself. There's so many resources now to help you with that and have a professional help you slowly lose weight. It doesn't have to be surgery or even medication. Sometimes it's literally having a good guide with your weight loss.
Is there anything that somebody can do prior to or while they're losing weight to help with the skin so that it's not as loose afterwards?
So this is all just anecdotal. I don't have data to prove this, but I do think that honestly, keeping your skin hydrated, moisturizing, I do think collagen supplements help. I think that the idea is that you're supporting and giving your body all the nutrients and nutrition it needs while you're breaking down, right? You're losing this weight. And so you need to support your skin health while you're going along. I think that does make some difference.
Are there any specific creams like tretinoin or peptides or growth factors or anything like that, or exosomes that you recommend patients to apply to their skin if they're in the process of losing weight or beforehand?
I would tell you the hard part is that a lot of those things are very cost prohibitive for the surface area. If it's your face, then yes, I actually am a big fan of exosomes. But if we're talking about the whole surface area of your body, then I stick with just good moisturizing. And so I will use like basic brands you can find in the drugstore. I think that daily moisturizing makes a big difference. But I think for your face that yes, then I do think that exosomes and tretinoin can work really well. I just think it'd be hard to cover the body surface otherwise.
How about non-surgical skin tightening treatments?
Mm-hmm.
So there are those out there. People are advertising them. Any thoughts on them? And can they help patients who've lost a lot of weight? Or is it just kind of don't bother, it's not worth your money?
I'm glad you asked this. I get asked this all the time. Patients like, I saw this on my feed. And so my answer would be is it's all about expectations. If your goal is that, hey, could I get maybe 30% better if I do certain devices, then yes, I think there are some really good radio frequency devices out there that work well. I think there's even some good other like modalities that can work well. But it's just knowing that, hey, what are you? If they're throwing up a picture and you see somebody who hasn't been through weight loss, don't expect those results. Your result might be improvement. It's just not going to be the same as somebody who they're showing who's the perfect model who doesn't have the same type of laxity and doesn't have the skin breakdown that you have.
Do you have any specific brands or actual treatments that you've heard good things about or that people have had some success with?
The one that I utilize the most, and I'll use this even when I'm doing surgically tools, is Quantum RF. So it is a radio frequency device. I like it because it's very controlled, and that I can use it pretty safely because I'm not treating the level of the skin. I'm treating the underneath portions of the skin, those attachments. And so I'm pulling in the skin that way. And I like that. I think that it works well. And so even when I'm sometimes surgically treating somebody, if I have a lot of stretch marks, a stretch mark's a break in the collagen. So what I can do is internally by pulling in, and it's a controlled burn, right? By doing that, I'm pulling in and I'm tightening them in, and I can actually get some good stretch mark internal tightening with that. So that's one that I've utilized in the neck and even on the hips and abdomen where I have a lot of stretch marks that's given good improvement.
So this is a device that uses radio frequency. It is invasive, so you stick a probe underneath the skin, so the person has to have some type of anesthesia involved, and then you're heating the skin using radio frequency from the inside.
Correct. If I'm doing somebody's neck, I can do that comfortably awake. So it doesn't always have to be complete anesthesia. Sometimes use something like laughing gas, just to make someone a little more comfortable. But small sections, you don't necessarily have to be in the operating room to do.
Any thoughts on, let's say, Renuvion that uses, I think, plasma energy? Another one is BodyTite that also uses RF.
So Renuvion is a device I'm familiar with and actually have myself. And I think it does well, but if I'm going to compare the two, I've gotten better results, especially in the weight loss population with using the Quantum. Renuvion is, like you said, it's plasma energy. I can't control it as well because you're using helium to increase that space and helps with the cool down. It gets hot, we need to cool it down immediately once we get to that temperature for your listeners to get the tightening effect. But I can't control it in the same way that I can control the other device. And so for me, in my hands, it's been better to use the Quantum RF in those areas. BodyTite is another good device. It's actually made by the same company that makes Quantum. It just has a slightly different modality of how you use it. I think the Quantum is an easier device for me to use, but I think that BodyTite still has some good applications.
So we're talking about treatments that are minimally invasive, but they are still invasive. You do have to anesthetize the area by local anesthetics. You have to inject anesthetic into the area to numb it up, essentially. What are your thoughts on using non-invasive treatments like radiofrequency microneedling, soft wave is big out there. Any thoughts on those for skin tightening, especially in patients who are either losing weight or have lost weight? Is there any utility to them?
Yes, there is. Again, same kind of thing. If we're talking about totally non-invasive surface level, it's the same. It's expectations. I think that if you have significant skin excess and poor elasticity, what you might expect to get at a minimum is 20, maybe 30% improvement in these areas. For some people, they'll find it worsens because the tightening might happen better in some areas than others. So versus having a larger area of laxity, you might have areas that look a little more tethered. So it's one of those things where I won't wholeheartedly say go for it. It's kind of like if maybe you want to give it a shot, it might improve things, but you take the chance of sometimes actually making things look worse.
Do you feel that one of those treatments is better than another in what you've seen results-wise? Because I know, we have Morpheus 8 in my practice. We don't do it for the body. We just do it for the face and the neck. There is Morpheus 8 for the body. I know some doctors are big on. I think we were at a meeting recently. One doctor was raving about soft wave. That's high intensity focused ultrasound. There are other ones out there like L-therapy. Do you have any preferences of what works the best for body skin that's starting to get a bit loose?
I do think SoftWave is a good device. I think it's a pretty good device. It is very surface level. So you can usually get some improvement on wrinkling and some tightening effects, very surface level with it. I think that like some of the other, things like, there's Virtual RF, Profound. These are all radio frequency microneedling devices. I think that they also can improve the texture of the skin, and some superficial tightening again, but I just am not sure if it's worth it money-wise. For everyone if they're looking for dramatic results with it. A new device out, Zerf, is another one that I'm curious to see. I'll be honest, I just brought it on. I'm excited to see it. I've seen good results but I haven't tried it yet for weight loss patients. So it's a to be continued to see if that's going to really give something significant enough for it to be worthwhile for somebody to do.
So we're going to talk about surgeries here in just a sec, but before we get there, I would like to ask you about something that surgery can't treat unless you're cutting them out, stretch marks. A lot of people who've gained large amounts of weight do find a lot of stretch marks in their skin. If you do a surgical excision, you're cutting them out. But what about people who have skin with stretch marks that can't be cut out? Let's say it's even after they have surgery. So let's say they have a tummy tuck, they've got stretch marks left over. Do you have any recommendations, or do they just have to kind of live with it because those stretch marks haven't been removed?
Yeah, I think that you can improve them. You can't take them away because, like you said, you can't really cut them out. Now you've traded a scar for stretch mark, and sometimes they're so abundant that it wouldn't be possible. Things that we've done that I think have improved is some of those devices we talked about before can minimize the appearance of it. So we'll do combinations of radio frequency microneedling as well as CO2 resurfacing, so carbon dioxide resurfacing lasering. That works really well, and I've gotten to the point where we can shrink down so that you almost thicken up. Think of shrink wrapping those stretch marks, and then you can actually do really beautiful camouflage tattooing. So we have some really great people in town in Houston who do very nice work with that to help blend it in, because part of the reason stretch marks stand out is because of their laxity and their texture. So if you can improve that, the other reason is because, especially on darker skin, they look very white in contrast. And so if you can then help it blend in, it just becomes less noticeable.
There are so many benefits to using red light therapy, especially when it comes to your skin. And taking care of your skin should be important for everyone. Well, that's why I'm so excited to tell you about Bond Charge's Red Light Face Mask. It's a great solution for a younger, clearer looking complexion. Red light therapy is a game changer for the skin, and it targets the skin's upper layers to restore glow, calm the complexion, and soften the visible signs of aging. And Bond Charge's Red Light Face Mask lets you do all of this with professional-grade equipment straight to your home. The scientifically backed wavelengths of red and near-infrared light work at a cellular level to energize skin cells and support skin elasticity. Plus, the mask's flexible design contours perfectly to your face. It is so comfortable. I love that red light therapy can help with so many different skin concerns. It's gentler on the skin than other treatments like chemical peels and in-office treatments. Also, some Bond Charge products are HSA, FSA eligible, giving you tax-free savings of up to 30%. Order the Bond Charge Red Light Face Mask today and start seeing the amazing skincare benefits. Trust me, it is worth it. For a limited time, my listeners get 15% off when you order from bondcharge.com and use my exclusive promo code Dr. Youn at checkout. That's BONCHARGE.com. You'll also get free shipping and a 12-month warranty. Go now to get this exclusive offer. That's bondcharge.com with the promo code DRYOUN to get 15% off. That sounds like it makes totally a lot of sense. Mm-hmm. Okay, so let's get into what is your main specialty, which is actually surgery, as is mine. Real quick question, you specialize in surgery on patients who've lost massive amounts of weight. And mm-hmm. we were emailing and you sent me something about MWL. MWL, yeah. And I was like, initially, I'm like, what does that mean? And I'm like, oh, duh. So what technically constitutes somebody who is a massive weight loss patient versus somebody who isn't, and who's lost weight but isn't considered a quote unquote massive weight loss patient? Because I treat a lot of patients who've lost weight, but I don't specialize in patients who've lost massive quote unquote amounts of weight.
There's two general definitions: either someone who's lost more than 100 pounds or someone who's lost more than 15% of their body weight. That's usually kind of where they'll say, okay, you fall into the massive weight loss.
If you're looking at operations, somebody who's lost massive amounts of weight, what's the most popular or most common operation that a patient who's lost a lot of weight would, let's say, start with?
Most people will start with a circumferential body lift. So that's basically a tummy tuck that goes all the way around. That's usually, if someone's even going to pick one surgery that they end up doing after losing all that weight, that's one of the most common ones.
So we're going to be talking about different surgeries here that you perform. And I would love to try to get for each of these kind of body areas, let's say 3 tips or pearls of advice, for somebody who does this for patients who are considering having that operation done. So let's say somebody has lost a lot of weight, they've been on a GLP-1 medication, and they're considering a lower body lift. You said what it does, it removes the excess skin from both the front of the body, like a tummy tuck, but also helps to lift the lower body up and remove excess skin from the back. What are 3 tips or pearls of wisdom that you can share with them about this operation if they're considering having it done by, let's say, somebody in their area?
Okay. So my first tip for you is go to somebody who look at pictures online and go to somebody who does a lot of these. Body lifts, it's not just a tummy tuck plus. There is a lot more involved with it. I always think there's lots of different vectors of pull with it, and you really have to have a good understanding of how you have to pull things to get the right result for somebody. And so make sure that you're going to somebody whose work you see lots of different body types and you like. Number two, I would say is really make sure that when you go in and you talk to your surgeon, and you're interviewing different people, that you're really clear about what you're wanting to achieve. For some people, the body lift does not end up being worth the trade-off of getting a flatter butt. And so then there has to be other things we talk about for, okay, how can we improve this maybe without flattening your bottom as much? Because I will tell you that that's one thing I've seen is some people get this shock that if they didn't discuss that beforehand and they're like, I don't have a bottom anymore. Because unfortunately with massive weight loss, sometimes that's the first place you lose it is in a place that we all need padding. I think my third one is really realizing that all of these surgeries, but especially a body lift, is trading off a well-placed scar for a better contour. And so what your surgeon's scar care and what their average patient's scars look like matter. So do your research on how their scars look like. And because while we can't control everything as surgeons, in general, you're going to see a pattern if someone has pretty decent scars across all their patients or if their scars aren't great. Because that's something that you might end up loving your shape and just be super miserable because the scars don't look great for you.
I think those are great pieces of advice. I think one thing that I struggled with, and I don't do lower body lifts, I did them a little bit early in practice, is the challenge of when people have, because everybody who loses weight, it's the interesting thing that I find when you look at the abdomen specifically, is that people then carry the excess skin and fat pockets that are still there in different places in everybody. So for example, most people will have skin that overhangs the pubic area. That's pretty common. They may have a roll of skin that overhangs their belly button. And sometimes that's all they have. Other people, they'll have a third roll that's between their belly button and their chest. And where'd that come from? And those I feel are really hard to treat because they're not directly in that area of where we cut out and pull down. The other group of patients that I find that has always been a challenge are patients who you can get their abdomen flat, but they have areas of their waist on their sides that stick out. And it's not necessarily skin. Sometimes it's a little bit of fat that's kind of protruding there. And when you're doing a tummy tuck, whether you pull the skin down or you do a fleur-de-lis where you're pulling the skin inward, that area still sticks out. And you can liposuction it, but they still have loose skin there. So these are things, for me, I think what I would say, if you're thinking about this type of an operation, really talk to your surgeon about what makes your body unique to you. Because if you have some of these things, like that third tier of skin that's high above the belly button, or those extra kind of love handles that are too high, they're much, much higher, those can be really challenging to treat, I find.
Yeah. And when I go through consultations, we spend a lot of time talking about that. And we don't just if this is my fourth tip is if you are going in for a body lift and you do have these kind of things that you really maybe bug you or concern you, ask, because sometimes as surgeons, if we're not really preparing you well, you might not realize that you need another surgery to fix that. Right. So it's just a good idea I like to go through everything that they're concerned about, even if we're focusing on one area at that time, so that we can talk about, hey, it may actually take me 5 stages of surgery or 3 stages of surgery for me to get all of these things treated. That way you're just preparing yourself both mentally and financially to be able to do all of this.
Okay, so we've talked about the number one most common operation in somebody who's lost a lot of weight, which is some type of a tummy tuck. You're talking about circumferential lower body lift. What's the second most common surgery in patients who've lost large amounts of weight?
So that would be a brachioplasty or an arm lift. That is very, very popular.
Can you explain what the operation is briefly, and then give us 3 tips if somebody's considering that operation that they want to keep in mind?
Yeah. So with this operation, you're basically treating this part of your arm, the forearm, or not the forearm,
upper arm.
It's like, so you're treating that part of the arm. And for most people, this skin is very unforgiving on that underneath part of your upper arm. And even with weight loss, it can get worse. Even if it's thinner, it can get longer and longer. And for a lot of people, they can't comfortably wear it. It rubs, it chafes. So you're trading by you take that skin and that extra fatty tissue out, and you have a long scar that goes on the underneath part of your arm. There's a whole textbook of where you can put that scar based on what your surgeon's preference is. I think it works best on the inner part of your arm. When your arm's down, you don't see it from the front or the back. But that is a permanent treatment to taking out all that extra skin, and you change the whole shape and contour of that arm.
So can you give us 3 tips if somebody's considering having a brachioplasty for them to consider?
So for the brachioplasty one, I would say, again, go to somebody who does a lot of them, because I always joke, you don't want to go to a surgeon who's like, man, I hate doing arm lifts. Like they're probably not the surgeon for you. Yeah. Scars are the biggest reason why people avoid having an arm lift. Because traditionally, like I know when I was training, we were like, oh, who wants that? The scar is terrible. There's better techniques now. I'm biased about this, but go to someone who uses Bridget's. That has changed the practice. And these are little clips, the tension relieving clips I put on afterwards. Since I started using those a couple years ago, my scars are predictable, and it's a dramatic difference. So again, I'm biased on that, but I've seen such improvement with those arm lift scars. And I think the third thing is make sure to, again, just like with the body surgeries, talk about your concerns. Some people have little interesting divots we call bands in their arms. Those cannot be fixed with this surgery, and sometimes it can make it worse. And so those are things you need to talk about beforehand, because if the trade-off isn't worth it, the big scar isn't worth it, or having maybe worsening of those bands, then it might be something that you choose to pass on.
I'm exactly the person who you just mentioned earlier. I would do about 2 brachioplasties a year. And I hated doing them, but I felt like, I had patients who asked for it, and I've done enough of them. Mm-hmm. And then I realized that if I'm doing 2 a year, I don't know that I can honestly tell my patients, hey, if you're thinking about this surgery, I'm a good doctor for you. Because really, when you look at studies are very clear that the more you do of a certain operation, mm-hmm. the lower the risk of complications and of a bad outcome. And even though I felt confident that I was doing things well and carefully and safely, and patients had great outcomes, like, am I still necessarily the best doctor for them? So I stopped doing brachioplasty a few years ago, because I was just like, look, I don't like doing them, and I only would do a couple a year at the most. Yeah. Okay, let's progress now to breast lifts with or without mm-hmm. implants. What percentage of your patients who have lost massive amounts of weight and undergo a breast lift also have an implant placed with it? And do mm-hmm. you perform those operations all at one time? Do you separate them? What are your recommendations for that?
So I would say a lot of the people that will have a breast lift choose not to have implants. They actually will choose to do structural fat grafting. That's very common in the weight loss population. But those that do choose to have an implant, I would probably tell you it's maybe 20 or 30% of that total group. Yeah. And I can't tell you why, but in that specific population of people, they seem very averse to having implants. They much rather use their own body fat if they need to have a little extra volume.
Can you give us 3 tips then for somebody who's considering having a breast lift?
Sure. So if you're having a breast lift, first realize that even though it might feel like you have a ton of breast tissue, because of skin excess, often if you do a lift only, your volume is going to be significantly smaller. I think that surprises a lot of people because they're like, well, I have so much that fills my bra, and so much of it's skin. And so often you're trading for a lot cuter, smaller breasts. It's going to be a lot higher up, but it's not going to be the same volume. If you are planning to have an augmentation with an implant, I usually will recommend that you do that separately. Don't do it especially if you're doing multiple stages. I think it is a better idea to set your lift, come back later, and then put your implant in, because sometimes the tissue is just not as strong, and I would like that scar tissue to be healed before I put something in. And the third thing I would say is be very vocal about what you want, because a lot of people say they want natural, but natural is hard. Like, so it's hard to describe. So I would say show pictures, get a good idea and do your research so that you can say something more specific or show photos. So that way your surgeon's recommending what you really want to achieve.
Do you ever take, let's say, if somebody has excess skin that extends out to their armpit areas, would you ever use any of that tissue to enhance the breast size? I think some surgeons are doing that.
Some surgeons are. I haven't as much. I just haven't felt like I get as nice a shape with it. But there are absolutely surgeons out there that do a beautiful job with that. For me, I'd rather replace that volume with other things than use tissue that I feel like sometimes is a little too floppy. Is the best word I can think of it to get a nice shape. But I do know there are some people that do nice work with that.
And then if you do use implants in patients, do you tend to feel the need to use some type of a mesh or some type of support for them? Or in general, do you try to avoid that and just use the patient's own tissues?
I'd say like 50% of the time I will use some sort of a mesh. If I'm doing where I kind of stack and rearrange the tissue, sometimes I can't use the mesh because of my blood supply. But 50% of the time I will, and I can't tell you it's the most scientific method, but I will literally just pull on that fold, the underneath part of that breast. And if I pull and it really just stretches, then I know I need to put something in there that gives me a longer term scaffolding for long-term support.
Yeah, one thing that I have done more and more in my practice as I've gotten older and more, I think, experienced is I'm staging my breast lifts with implants more and more. When patients have a lot of tissue that's real droopy, quite often I'll do the lift first, and then we come back 6 months later, put the implant in, because I do think, just like you mentioned, it's going to be a more stable result, a more long-lasting result. And even though it's a pain for them and for me to do 2 operations, I feel like long-term you have less risk of it redrooping, because you truly can kind of remake the breast where it should be, and then put the implant in later as if it's just a first-time augmentation type of thing.
And one thing that I've tried, and you and I had met when we had gone to Costa Rica, is I've actually had a couple of my weight loss patients, and I've been doing the new Preservé technique on them to see if that allows them to, I'm really disrupting very little. I've already done their lift before. So I'm excited to see if that's going to be a better way to take some of the pull off of, because I'm not releasing as much when I put the implant in.
Probably fourth, I'm assuming, are thigh lifts. Is that right?
I guess that would be thigh lifts. Before thigh lifts would be upper back lifts.
Okay,
before a thigh lift. So we call it a bra line lift. And that's really getting that back roll that often you just have to take out. That's skin. It's rarely a ton of fat.
Mm-hmm. And any tips for somebody who's considering a bra line back lift? Other than ask your surgeon to put the scar in the bra line.
that was
and if you're a guy, then
one.
If you're a guy, then it is just where it is.
Some men decide to do it, and they're like, you know what, it's worth it to me. I think that's the big thing is wear your your usual bra so that they can mark that out. That's the big thing with it. And a bra line lift is worth it. Sometimes you can get away with what I call a broken body lift, where you do a bra line lift at the same time as an extended tummy tuck, because you might not even need the lower part of a body lift. So just the same type of thing. It's just looking where your areas for treatment are, and thinking if you're like, wait, I carry most of it on my upper back, not really my lower back, you might be a person who's a good option for that.
All right. And let's finish with the thigh lifts. Thigh lifts are big operations. I hate doing them. I never did them in practice because I'm like, I don't want to, you see patients are in stirrups and you're just, I don't want to be there. So I don't do them. But can you explain the operation briefly to my audience? Because I will never do that. And can you give maybe 3 tips of advice if somebody's considering this operation?
Usually I'm going to tell you, do your thigh lift last. If you're sequencing through surgeries, it's your last thing to do. Sometimes because you find that you lose a little bit more weight with all of these and you want to get your thighs as slim as you can for the surgery. The best way I can describe the surgery is it's an arm lift for your leg. Same technique that you're using. The scar is going to go in that inner part. So the goal is that you can't see it from the front or back. Some people will cut under the bottom. I don't like that technique. It's not a natural place to have a cut. So I'll make it like a hockey stick and it curves up into your groin there, and I can work out the excess that way. Don't do a thigh lift on your own. That's a big tip. You need help with that. You need help with getting up and moving, because it's hard in your groin area. It's a high chance of breakdown for that surgery. So you really want to make sure you've got some extra help with it. But I think thigh lifts can be super dramatic. I don't think anyone's ever regretted doing it. But the first week, they're all like, why did I do this? But same thing I told you for all of them. Go to somebody who does a ton of thigh lifts, because I love them, and you got to love them because they are a little bit of a painful surgery for us to do as well.
So when somebody heals from a thigh lift, how much settling should they expect? Because that's, I think, something that I have people ask me, and I don't do the surgery, but say, and what they'll do is they've got skin that's hanging in the inner thighs, and they pull it up. They go, this is what I'm looking for. And of course, they're pulling it up and it's nice and tight. And I tell them, look, you're not going to get that result. Maybe initially it's going to look like that, but things do settle. I mean, gravity is going to pull specifically right down in the wrong direction in that area. What do you tell them as far as what they can expect of how tight they'll be afterwards, and let's say how smooth they might be?
So if I'm doing a vertical thigh lift, so that means that big inner scar, I would expect somewhere around 20 to 30% maybe settles if somebody has pretty poor skin quality. Because sometimes just because you have a lot of excess in your thighs doesn't mean you have bad skin quality. A lot of it is genetically where you carry it. So if somebody has good elasticity and they've got, I can tell they've good collagen, then I might only get about 10% settling. Now, if you're doing a horizontal only thigh lift, so that means that just that crescent in your groin, that surgery is not great for a lot of people. It works perfect if you just have a little bit of skin excess there. But if you're trying to fix something around your knee, that's how far away the distance is, and you have heavy thighs, you're absolutely not a candidate for the surgery, and your scar will start in your groin and will end up on your thigh. And I think that that's a biggest mistake I see with the thighs. So a tip I would tell you is if you have a lot of heaviness in your legs and it goes all the way down, and that surgeon is telling you, oh yeah, we just have to do this little horizontal scar, that's not your surgeon. Because you have to manage the vectors of how that pull is. So that's why for most people who've lost massive amounts of weight, you're pulling in and you're pulling up so that you don't have the same, you're redistributing those forces so that you avoid having as much settling.
That makes a lot of sense. And if somebody asks you, I've lost weight, but I'm thinking of losing a little bit more, when's the right time for me to consider surgery? What would be your answer to that?
I think it's good to start talking with and researching maybe 6 months before you are getting within about 10 pounds. I like most patients to be within 10 pounds. We've done 20 depending on how much weight you've lost, but I think that's a good time to start researching and taking a look at things. But I think that we've had people who just had their bariatric surgery and they call us because they're so excited. It's just too early. We don't know how things are going to look. So I think that you would like to be pretty much 6 months away from being within that range to start talking with people and looking into things.
Yeah, that's exactly what I tell my patients is be within about 5 to 10 pounds away from where you feel is a good, healthy weight for you, because it's very common that, let's say, you have the surgery, we may take off a few pounds, you may lose your appetite for a while, lose a few more pounds, and really losing up to 10 pounds, I feel like after most operations, isn't going to cause your skin to redroop again. 20 pounds could be a different story. So I usually tell my patients 5 to 10, and hey, you may lose a few just from the surgery itself, as well as afterwards as well.
Absolutely. I think it's funny too, is a lot of people will look at it and be like, well, how many pounds am I going to lose? And I'm like, it may only be 10 pounds or 20 pounds of tissue I take off, but you look like you lost 3 times that because your whole shape changes. It's pretty amazing.
So the maximum I've ever removed from somebody was 25 pounds. And this was a patient that actually I did with our common friend, Dr. Danielle DeLuca-Pytel. And this was a woman who had skin literally hanging from her abdomen all the way down below her knees. And we did this together. We had the two of us, 2 PAs, and we did it for on the doctor's TV show. This is many years ago.
Oh, yeah.
So I maxed at 25 pounds. What's the most skin weight-wise that you have taken off of somebody in one operation?
In one operation, 30 pounds is the max I've done. So I've never gone. Now, if I collectively do some people, collectively, I probably have taken hundreds of pounds off of people. But I would say that
30 is a lot, though. I mean, you've beaten my max, so that's good. So tell us about this textbook that you have coming out. I know that my listeners are, in general, a lot of them are not plastic surgeons. They're not going to be reading the textbook, but this is something you're really proud of.
Yeah, I'm really, but because like we talked about with the GLP-1s, weight loss, this is becoming something that's probably more and more relevant to many of you listening now. And we want to make sure that all the surgeons out there are equally as educated on how to help everybody, because not everyone's going to one surgeon in town. So it's called the After Body. And this is going to be something that we're writing for plastic surgeons, but we're also writing for other doctors who take care of weight loss. So I'm bringing together doctors from all different backgrounds so that we can really come up with a good source to be able to educate everyone so that we're taking care of everyone listening here really, really well. And I'm really proud of it because I'm able to bring together some of the people who wrote these original weight loss textbooks, and they're all going to be contributing to this. So I'm excited for us to up the education level for everybody out there.
Well, sounds like something great you're doing for people in the field as well as for all of their patients. I want to thank you so much for joining me today. This was great.
Thank you so much for having me.
So my guest this week is Dr. Vinaya Rednam. Her website is drrednam.com, and we'll put a link in the caption of this podcast. She's also very active on social media. She's got a very active Instagram account, so I would encourage you to follow her, especially if you're losing weight. If you're one of those types of patients who've lost a lot of weight and you're considering surgery, you can get a lot of great information from her. She is very active on social media and on her website. And she has a podcast called The Confidence Doc, where I'm actually on it right now. Actually, this week,
yes,
I think I'm on.
It came out today.
So check out her podcast as well, The Confidence Doc with Dr. Vinaya Rednam. Thank you so much for joining me. I really appreciate you.
Thank you so much for having me.
And thank you, everybody, so much for watching and listening. This is a Dr. Youn show. I want to ask you if you do get a chance to leave a rating or review on iTunes or Spotify, or wherever you get your podcasts. It really helps me spread the word, and every week I'll give a quick shout out to somebody who does. Otherwise, I will leave you with this. Thank you so much for watching and listening. Adopt, don't shop, save a life today. Thank you so much, everybody.